Hi, I'm Richard Sanchez, and I'm here today with Dr. Nathan Emery to understand more about cataract surgery and what patients can expect. Dr. Emery, great to be with you today at Pasadena Eye. Wanted to ask you about Pasadena Eye and your time here, which has been many years, and what sets you apart from the community in terms of eye care services.
Well, thank you, Richard. It's good to be here with you today, and I appreciate the question and the opportunity to talk a little bit about that. Pasadena Eye Center has been here for many, many years. I joined up in 2003, so it's been a little bit over 20 years now. And I think what we really have always tried to provide to the patient here is a very customized personal experience where the patient feels that their needs and their eye care is being taken care of in a very compassionate fashion and with very good skill and just being taken care of in the way that they feel their eyesight should be taken care of. And over the years, it's just been a great privilege and honor to have the opportunity to serve a lot of people through taking care of their vision and their eye needs.
The location here is one that is very convenient for patients. You have a surgery center that's right on site, is my understanding. Cataract surgery is a lot for seniors like myself, and I believe I'm moving into the need for cataract surgery. Tell me about that first symptoms of cataract surgery.
For cataract surgery, as far as the symptoms goes, initially patients will start to notice a lot of fairly common symptoms that include noticing their night vision is starting to go down, difficulty seeing street signs, a lot of glare issues. They'll find when they're doing things such as reading, they'll need more light to be able to see. Just the overall quality of vision won't seem as sharp and as clear as it was. And it's generally speaking a gradual process with patients, not something that you go to bed one night and wake up the next day and all these symptoms have just suddenly appeared. But they'll notice over time that these symptoms start to gradually creep in, eventually until a patient says, you know, I'm just not seeing the way that I used to be able to see.
Boy, oh boy, you've hit on about 4 things that are happening to me at night. Additional light to help read, just difficulty, at times. But I'm also hearing about different types of cataract surgery. Like they call them advanced technology lenses. Can you chat a little bit about that?
Sure. When it comes to cataract surgery, there's really 2 options we have to discuss with patients. And one includes the type or the way that the surgery is done, and then the other component is the type of lens implant. A cataract is a natural clouding of the lens of the eye. Everybody develops them, it's just part of life, and it's a matter of when they develop enough that they reach the point that we need to correct for it surgically. Now the good news is a cataract's not hurting your eye, it's not creating any damage that we can't reverse, but it does limit the vision, so until we remove it, the vision will remain compromised and it will continue that way until it's treated. When we remove a cataract, the options that you'll hear about includes what's called laser cataract surgery, and that's a technique where we use a laser that will do part of the surgery for us. Now, what the laser technique offers that a standard cataract surgery doesn't do is the laser is able to do a few things for us, including treating some degree of astigmatism, which has to do with the shape of the eyeball. By treating the astigmatism, just gives patients a better quality of vision uncorrected without their glasses. The laser also softens up the cataract, so it comes out a little bit easier as we're removing it from the eye. When we have to remove a cataract, we use an instrument that's ultrasonic in its nature, so ultrasound energy is used to break the lens up and remove it from the eye. When we use the laser, it softens up the cataract. And then the laser also makes a lot of the incisions on the eye, so instead of doing them by hand with a blade, the laser is very precise and it's just able to offer a level of precision that's very nice. So those are the 3 biggest benefits of the laser. Now, the next question that a patient will wonder is, okay, well, what type of a lens? When we're taking a cataract out, we're removing the lens in its entirety. So we have to replace and put a new lens back inside the eye. And it's a prosthetic lens, it's plastic in its material. The nice part is it's good forever. So once it's in there for the rest of your life. And each lens is customized for the individual patient. The benefit of those lenses is we can correct a patient's vision with the lens. So not only is the lens clear, but it's corrective. And because of that, we can try to diminish the need for glasses as much as possible. A standard lens will have one focusing point. So we'll often correct for distance vision, targeting from about arm's length out is what we would include in distance vision, so that patients at that range will do quite well without their glasses. Anything from about arm's length in, they'll need some kind of a reading glass or prescription to see up close. Well, there are lenses now that have the capability to focus on all the different aspects of vision. So distance, intermediate, reading, so a patient could watch TV, look at their computer, read a book, and do all those things quite comfortably without glasses. And there's different types of these lenses. Some are called extended depth of focus, some are called multifocal, and others are what we call a light adjustable lens. So there's different options we have to try to customize to what the needs of the patients are.
And after the surgery, is it a week recovery, 2 weeks recovery? What's the process?
So generally speaking, even the next day, patients are actually seeing quite well. So they're able to function and to do most things that they're typically comfortable doing. For about a week, we'll ask patients to avoid real heavy lifting, maybe some golfing, bowling, swimming, stay off that for about a week. And there are some drops that we'll have patients utilize. The drops patients will use up to about 3 to 4 weeks post-operatively. After about 1 week, there's really no restrictions as far as activities go. Patients can pretty much resume most activities. And so typically there's not much impact it has on a patient's lifestyle over the course of the healing. Some minor restrictions that first week, but generally speaking, patients can function and accomplish the things that they would like to that first week.
Very exciting. I know you've done tens of thousands of surgeries, and your kind of reaction to patients, it's really just a wonderful outcome for someone to be able to see better, especially at our age.
You know, it's one of the great blessings, if you will, of this profession is the benefit that you see when cataract surgery is done and the joy that it brings to a lot of patients. And you know, you ask about anyone in particular, really consistently, week after week, there's just patient after patient that is so grateful and so excited to have such an improvement in their vision, and in many cases to really limit their need for glasses as well. You know, a lot of times patients don't even fully appreciate how much a cataract's impacting their vision until they get it out. And quite often they're quite pleasantly surprised as to how much improved the quality of their vision is. And there's a lot of cataracts out there, Richard. Everybody gets them. It's just part of life. And so as we're able to help with that and to improve that, patients really find a lot of joy and appreciation in it.
Dr. Emery, the coverage for cataract surgery, there's a lot of options, and how does one figure out all those options in terms of payment?
Yeah, it's a really good question, Richard. Cataract surgery, generally speaking, is a covered procedure by insurance. Where some of the costs come in that patients have options has to do with the type of lens and going back to, again, the type of surgery, whether we use a laser or not. Some of those components will not be covered by insurance, and so a patient has the option, should they choose them, to be able to put in one of these new technology lenses or use the laser when we do surgery. And so our staff is excellent at sitting down with the patient and explaining to them what the options are, what the costs are, and the different ways and means that they can be addressed and taken care of by the patients.
And in terms of myself, and actually some of my friends have had LASIK or LASIK type surgery in the past, can I still get a cataract?
Yeah, again, that's a really good question, and we see that more and more as patients have had LASIK and any kind of refractive surgery over the course of time. And that does not preclude you from having cataract surgery. And so patients that have had LASIK or PRK or RK, as many have, are certainly not kept from having cataract surgery. When we do calculations for the lens implants in the eye, there are some things that come into play, and we have the technology to address that, to make certain that those patients that have had prior refractive surgery get excellent results and are very pleased with the quality of their vision.
And the practice here is, I mentioned, is very convenient in Pinellas County, and a lot of seniors are in this area. Coming in today, just the staff here, the team around you, it seems to be just quite happy.
Well, we hope so, and one of the great things here at the Pasadena Eye Center is the staff and the quality of the staff that we have. They do an excellent job of really caring for the needs of the patient and helping them to feel comfortable, and just great workers, and are excellent in their craft and very personable. And I hear compliments constantly just on the staff and the quality of them. As you mentioned, Richard, one of the nice convenient parts here is not only we have our eye center here, but our surgery centers here at the same place. So everything is able to be accomplished here within this building. And just as the eye center has outstanding staff, so too does the surgery center. And patients, without hesitation, the next day are always telling me how much they appreciate the staff at the surgery center and what an outstanding job they do and how comfortable they felt for the surgery and with everything that transpired.
Great. Well, I've really enjoyed our visit today, and I'm actually pretty excited about the cataract surgery that we'll be coming to see you about.
Well, thank you, Richard. We're excited to get you seen a little bit better.
Thank you, Doctor.
All right, thank you.